Good morning and welcome to the San Francisco Interfaith Council online briefing for faith leaders. In today's program, San Francisco Health Officer Dr. Susan Phillip briefs faith leaders on the status of COVID-19 and recommended precautions. Thank you. A special thanks from the San Francisco Interfaith Council online briefings are supported by a grant from MetaFund. Thank you. The important and ongoing work of the San Francisco Interfaith Council would not be possible without generous funding from congregations, corporations, faith-based social service agencies, foundations, judicatories, and supporters like you. Help us spread the word. Visit sfinterfaithcouncil.org to learn about SFIC programming and how to become a supporter. Follow SFIC on Facebook and Twitter. And subscribe to SFIC's YouTube channel to watch all of our virtual events. A bit of housekeeping. Today's program is being recorded. For audio and video, all participants are muted and without video to minimize distraction. To submit a question or comment, select the chat button at the bottom of your screen and send a message to Q&A. Questions will be forwarded to the presenter following the program. Closed captions. To activate closed captions, select the live transcript button at the bottom of your screen and click Enable Live Transcription. As COVID-19 case rates climb, now is the ideal time for San Franciscans to prepare by taking actions that can protect them, their families, and their community. By staying up to date on your vaccinations. Know how to reach your doctor. Keep a supply of rapid COVID-19 over-the-counter tests. Keep masks handy. Plan ahead for a possible infection. And stay informed with trusted sources of information such as sf.gov/COVID. With changes in federal, state, and city masking guidelines, it can be difficult to know when to mask. The best advice is to bring a mask with you everywhere you go, as you may be required by the organization, business, or transportation agency to wear one. The vaccines are safe and effective. Go to sf.gov to find a vaccine site or vaccine event in your neighborhood. Now is the time to come together, San Francisco. Together we can stop Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality. It is simply a disease. To report a hate crime, call the SFPD at 415-553-1133. And at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you, Trey. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for faith leaders. With reports of a rise in COVID-19 positive test rates and hospitalizations throughout the Bay Area region, San Francisco faith and religious institution leaders are seeking guidance regarding how the virus is impacting our city and prudent precautions to take to protect and ensure the safety of those entrusted to their care. This week's online briefing for faith leaders, hosted by the San Francisco Interfaith Council, welcomes San Francisco Health Officer Dr. Susan Phillip, who will report on the COVID-19 status, what the latest case and hospitalization counts indicate, the city's strategy to mitigate its effects on highly impacted communities, and recommended actions to avoid getting infected and lower the spread of the virus in our communities. At this time, it gives me great pleasure to welcome Nancy Nielsen, the chairman of the board of the San Francisco Interfaith Council, who will offer a brief welcome as well as read the Interfaith Statement. Good morning, Nancy.
Good morning, Michael. Thank you, and welcome to everyone. I think most of us are today gathered with heavy hearts. It is difficult to focus given the events of the last few days. But again, we are here as an interfaith community to learn and to support one another. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this setting, it should be offered according to the tradition with which we identify. If we were invited to speak on the subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other that we might better understand the multiplicity of faith traditions in our city and in our world. Welcome to this gathering.
Thank you so very much, Nancy. You know, at the very beginning of the pandemic, when we were talking about frontline heroes, it was very important that this council lift up chaplains in our hospitals, because when clergy and families could not enter hospitals, these were the spiritual lifeline, bringing God's love to those who were hurting both physically as well as emotionally and spiritually. We are very blessed to have with us today Reverend Chaplain Claire C. Bowman, Executive Director of Sojourn Chaplaincy, Multi-Faith Spiritual Care at the Zuckerberg San Francisco General Hospital and Trauma Center. Claire, thank you so much for being with us. You're one of my biggest heroes, and am grateful for your presence here today, but most importantly for the ministry that you are offering at the General and to our city. We invite you now to offer us a spiritual grounding and reflection for today's program.
Thank you so much, Michael. It is such a privilege and an honor to be here with you today. And thank you for the work of the Interfaith Council throughout this pandemic and the way that you have been supporting clergy and faith leaders in this pandemic. I want to thank each of you for being here today and for your commitment to supporting your community's health and wellness. As we've been at the General serving some of the most ill and most vulnerable members of our community with COVID, it has been a great comfort for so many of the staff and patients to know that there is such a supportive faith community here in San Francisco. So thank you for your ongoing commitment to both the people that you serve in your community and our larger community here in San Francisco. I had prepared something around COVID and a reflection around that, and then Uvalde, this horrible tragedy happened. And so I wanted to take a moment to lead us in a prayer amid gun violence. This is a prayer by Virginia Avnell Spatz, slightly modified. So I invite you into the spirit of prayer, meditation, reflection, whatever that looks like for you. Spirit of life, spirit of love, you who we know by many names, hear our prayers. Guardian of life, liberty, and the promise of peace, may our nation always merit your protection. We recognize that gun freedoms in our nation have resulted in too many losing the freedoms to full lives. We know that peace anywhere might be shattered in a moment, but we know too that many in this nation rarely experience the safety some of us take for granted. Oh God, grant the fearful your sheltering presence and help us all to understand and address this burden. Among us are healers and clergy who directly deal with the aftermath of gun violence. Sweet Creator, grant the responders strength in turmoil and help us all to support their work. Among us are those who mourn victims of gun violence. Great mystery, grant the mourners comfort and help us all to better support them in their grief and cries for justice. Among us are those who have experienced gun violence. O divine spirit of compassion, grant the shattered healing and help us all to recognize this trauma and its cost. Teach us to recognize the effect of gun violence in our lives and in the lives of so many of our nation's children. God of justice, grant our leaders the ability to remember their commitment to the people who elected them. Grant them wisdom and courage to act and effect change. May they govern with justice, compassion, and a clear commitment to ending gun violence. Beloved divinity, shine your love through this terror. Heal us, our local, national, and global communities. Lead us towards communities free of affliction and strife, bodies and spirits untrammeled by gun violence. Help us to be agents of peace. Help us to bring forth healing in the face of so much brokenness. Help us to be midwives of justice. Help us to birth change soon and in our lifetimes. Amen, Ashe, Aho, and blessed be.
Thank you so very much, Reverend Bowman. We needed to hear this today, and it's a blessing to have you with us. Thank you. Speaking of blessings, it is a blessing for us to have Dr. Susan Phillip, the health officer for the city and county of San Francisco. Dr. Phillip is no stranger to this program. She has been from the outset advising us and all of the communications that our faith leaders in our 800 communities of faith and religious institutions have been receiving for the last 2 years. Timely, credible information have come from Dr. Phillip's office and from Dr. Phillip directly. And I would just say, Dr. Phillip, as a preface to your presentation, it's the tradition of people of faith to pray for those who protect us. And we have been praying for you. And our prayers are not just prayers, but they have been actualized also in taking to heed the precautions and the advice and the guidance that you and your colleagues have given us. And we just felt like as the case numbers rise, that it was appropriate at this time to invite you to guide us further. So without further ado, I give to you the health officer of the city and county of San Francisco, Dr. Susan Phillip.
Thank you so much, Director Pappas, for having me today, to Chair Nielsen and to Reverend Bowman for those very, very powerful words. I'm so happy to be with you. It's been a very somber few weeks with gun violence, as Reverend Bowman has said. We also have concerns that many people have voiced about where COVID is. So I hope that I can give you a little bit of information that you can take. And as Director Pappas said, I have fully seen how you all have made your faith real by caring for your congregants and for our neighbors in San Francisco. So thank you for that. We would not be where we are as a city without your efforts and the efforts of so many people that you serve and work alongside and lead. So I will ask for my slides, Trey, if you're able to pull those up. I don't have very many slides. I know that there are some wonderful questions and points for discussion, so we'll want to make sure to get to all of those. But we'll go to the first slide, please. So just to orient us to where we are, the last time I had the pleasure of speaking with you all, we were talking about the Omicron surge, that variant that was initially identified in the US right here in San Francisco at the very beginning of December 1st. And what we have now is another swell in cases, but nowhere near as high as it was in December and in January. So if you look at the graph at the bottom left, you can see our case numbers, our average per day. And what you see is that very, very high spike, extremely high, over 2,000 cases on average per day that was happening with the Omicron surge. We came down, we had some low numbers for a while, and then we're seeing now a swell, an uptick as well, nowhere near where we were a few months ago. But these cases are caused by further subvariants from Omicron. People may have heard of the terms BA2, and now there's BA2.12.1. And really what this is indicating is this is what viruses do. They replicate themselves, and randomly there are sometimes these mutations that occur, and some of them confer the ability of that virus to transmit more readily person to person. And that is what we are seeing. So these new variants, subvariants, are much more transmissible, even more so than Omicron. But very fortunately, they do not seem at this point to be evading and going around the vaccinations and the treatments that we have available. So even while cases are going up, we are not seeing more instances of severe disease or people who are dying from COVID-19. So that is a very positive thing, even while it is concerning to so many people to see the cases going up. We do have quite a bit more COVID now in San Francisco than we did previously. Of the people who are getting tests, and the tests are being reported to us at the Department of Public Health, about 11% of those who test are testing positive. And we know that this is likely an undercount because many people are testing at home. Those tests are not reported to the health department usually. And we also know that some people have very few symptoms and are not testing as regularly. We are not encouraging routine asymptomatic testing for most people. And so all of this might mean that the cases that we have and that we're seeing are actually a little bit, maybe even higher than what we see. But you see the numbers here on the lower right, the average case rate, so that's the rate adjusted for the population in the city per 100,000 residents, is at 52 right now. It is higher for unvaccinated persons than it is for vaccinated. But it's a really important point to understand that the vaccines are doing their job at keeping people out of the hospitals and keeping people from dying, from keeping people alive if they have COVID-19. But they are not able at this point to fully keep people from getting infected. So that is not a failure necessarily of the vaccine. We wish that they were 100% effective at keeping infections at bay, but given where we are, it's really important that they're maintaining their strength against severe disease, and that's really, really important on a population level and for individual people to understand as well. Next slide, please. So hospitalizations of people who are testing positive for COVID are increasing. This is expected as the case rates go up. It's within our health system capacity. We are also trying to tease out, it is not the simplest thing in the world to figure out which people are admitted and incidentally test positive for COVID and which people are going into the hospital because COVID is making them sick. So we are in the process of trying to tease that out. But we know that as cases go up all around us, the people that are in the hospital are no different. They started out in the community as well, and they also may be likely to test positive. The highest risk for severe disease and being in the hospital, of course, are the people that remain unvaccinated, and then people who are medically vulnerable because of older age and or health conditions. In San Francisco, we can be very, very proud as a city, even as we need to continue focus and we continue to make efforts to work with all our communities, that we have the lowest death rate of any of the counties in the whole country that have over 100,000 population. This is the result of work that you all have done, that many other partners across the city have done to really ensure understanding of the importance of vaccination and access to vaccine, especially to our most impacted and most vulnerable communities. So we have unfortunately lost 875 people as of May 20th to COVID. That is far too many. Any loss of life is tragic. And we're so thankful that we've been able to keep many thousands of people safe with all the efforts that have happened, all the actions that you all have helped make happen in San Francisco. Next slide, please. And again, the underpinnings of the success in San Francisco and what has made us a model around the country and even the world has been the effectiveness of the campaign to get vaccinations and boosters to all of our residents with an equity focus. We have one of the highest vaccination rates, as I said, in the country, and that includes among people of color, with a special focus that we've had as a city, and we continue to have as a health department, of partnering with community organizations, faith-based organizations, and others who really are connected and know our communities the best, and having them guide the efforts and guide the way we move forward. As a result, although we are having an increase in cases now, we have less severe disease than other parts of the country. When it comes to having boosters, though, we are continuing to see some disparities by race and ethnicity, with people of color somewhat behind in receiving the boosters. And this is really important, and it continues to be an ongoing message that we do want people to have the boosters that are available to them when they are recommended to get them, to again lessen the chances of severe disease. The vaccines are effective, but what we see with the current vaccines we have is that the effectiveness declines somewhat over time. And so as the studies come in, and as the CDC and the state and we are looking broadly at recommendations, we want to follow those national guidelines and recommend that people get boosters when they are eligible. And as of right now, people who have had completed their primary vaccine series 5 months ago, and who are 50 and older, it's recommended that people get at least get their second booster as well, and have their first booster also. So, the question often comes up, how many boosters are we going to need to have? We don't know exactly the answer to that, and people are working, public health and scientists are working to try and understand what that might look like. So at the top are really just the statistics and the very high numbers that we've received for an initial vaccine series, and below is looking at this by race ethnicity. And again, there have been concerted efforts over time to really move all of the communities, all of the racial and ethnic groups forward, so that all of our communities have access to these life-saving vaccines. Next slide, please. So as I mentioned, the CDC has strengthened the recommendation that everyone who's 12 and up, who is immunocompromised, and those who are 50 and older should receive a second booster at least 4 months after receiving their first booster. The COVID-19 medications like Paxlovid is increasingly available for people who might be at higher risk because they have underlying health conditions, or because they are age 65 or older. Paxlovid is an antiviral medication. It's a combination of medications, and the studies have shown that when it is taken within 5 days of developing symptoms and testing positive, that it reduces the risk of hospitalization by 90%. So it is remarkably effective, and it's really important that people know that it is available, because what we don't want is people delaying getting their tests, getting their diagnosis, and or getting this medication. So we've been working with our health systems, including our own health system, the San Francisco Health Network, that includes Zuckerberg San Francisco General Hospital and all our clinics, to make sure that we are reducing barriers to accessing that life-saving treatment. Booster doses have also expanded to children 5 to 11. This is at 5 months after completing the primary series. We're recommending that parents and caregivers think about this, increase protection by boosting their children when they're eligible. We're following the state of California in this recommendation, and we know that parents may want to speak with their own pediatricians about this, and we encourage that. We are eagerly anticipating a vaccine. We're eagerly awaiting news of a vaccine eligibility being extended to our youngest residents in San Francisco, age 6 months to 5 years. We anticipate that an initial advisory committee to the Food and Drug Administration will hear the data around this, supporting this, as of June 15th. And then it will follow recommendations and authorizations from FDA and recommendations from CDC. And we're hopeful that in the month of July, we will potentially be able to offer these vaccinations to these young children. Right now, all of the Bay Area health officers, and including me in San Francisco and our health department, we're strongly recommending that people increase their own precautions, their own personal protection, given the increase in cases. And it's strongly recommended that people wear masks in indoor public settings at this time, given this swell. And as a reminder, I know we have shared this before, but the best masks are the more high quality respirator type masks. So the N95s, the KN95s, the KF94s, or even using a double layer of a surgical mask with a cloth mask over it to tighten the fit. Next slide, please. So we continue to have such important partnerships with community-based organizations and faith-based organizations to keep people safe and informed. So our discussion today is another part of that. We're so grateful for that ongoing partnership. We as a department and as a city continue to prioritize funding and resources towards our most highly impacted communities and to people that are at highest risk of severe disease, including people who are residing within skilled nursing facilities and other long-term care facilities. We are doing this, unfortunately, with some decreasing resources. As people may have heard, the US Congress has not voted to make additional funding available to states and then in turn to local health departments. But the funds that we do have available, that we continue to have and are committed to working with, are really going to be prioritizing, again, these communities, these partnerships differentially because of the equity approach that we're trying to take. The COVID response, as a result of some of these shifts in funding, and also a shift in the way that the virus is behaving, and the knowledge that the virus is going to continue to be with us in some shape or form, we are working to really strengthening our primary healthcare systems to be able to serve people. People can get medical support and services with their health system providers, including testing and treatment if they do test positive and if they are eligible for treatment under the federal guidance. Our safety net in San Francisco is in place with our health system, with DPH community health centers, and we do continue to have a COVID resource center. And this phone number in this line is an important resource to be able to share with congregations, with leaders in your congregations and organizations that help serve clients and congregants if they do need help with any aspects of their COVID prevention or COVID treatment. And then we really have been focusing on this Be Ready campaign and be able to understand and know how to use the tools to protect people, to protect themselves and their families when needed. Next slide, please. So the basic elements of this idea of being ready really do encompass the fact that I just mentioned, that COVID is going to be with us for some time. And the reason I say this, it's not going to be easily eradicated or quickly dealt with, is that we know that there are many parts of the world that still have not been able to vaccinate large numbers of their population. And, we applaud all the efforts globally to increase vaccine equity and access. We also know that COVID, unlike some other viruses, it does exist in animals worldwide, not just in people. And so there continues to be what we call a reservoir, or place where the virus can be and continue to sort of come in and out. So we were likely to see these ebbs and flows of the virus. We also continue to watch to see what new variants or subvariants emerge and whether any additional public health action is needed based on how severe they might be or how they might interact with our current vaccines and treatments. But again, for now, current vaccines, current treatments are holding well against the severest forms of illness from the current subvariants that we see. So we want people to think of this as being ready as we are for changes in the weather, and knowing what are the tools that we can take out when needed, when there is a swell, when there is a surge. And having the supplies and the know-how and the right information, phone numbers on hand is really important. And people can go to sfgov/becovidready to see this information as well. Next slide, please. So what does it consist of, and what do we want San Francisco to know about being COVID ready? The most important thing is being up to date on COVID-19 vaccinations. This is the first and most important defense that we have against the most severe outcomes. We want people to be able to keep rapid tests on hand, and if they're symptomatic, to take them. And it's an important idea. It's a good idea even before COVID, but if you're feeling sick, do not go to your house of worship that day. Do not go to work or to school if you're able to avoid that. Stay home until you are feeling better. And testing is important when people are feeling symptoms as well. There are free tests available. The federal government has announced it's offering a third round of free tests to people, and they are able to order up to 8 tests for their household as well. And then insurance is also required to reimburse people for tests. In San Francisco, we are also partnering to provide rapid tests, and we continue to have testing resources through our health systems as well. We want people to have masks on hand. Unlike in earlier parts of this pandemic, masks and high quality masks are more easily available. So again, N95, KN95, KF94, or using a double layer is what's recommended. And then having a plan in place and thinking through what would happen if a person in the household became infected, tested positive. And that might mean figuring out a work plan, a childcare plan, a care plan for a family member. And then knowing how to reach a doctor. We're fortunate in San Francisco that because of California Medi-Cal eligibility, because of Healthy San Francisco, there are very few people who on paper would not be able to access primary care. But we know that there remain barriers and difficulty for equity purposes of getting time off work or other things to be able to get health care. But we want to make sure that people explore now how they can become connected to primary care, how they can be connected to their health systems. And if they have providers, now's a good time to ask, hey, am I someone who might need antiviral treatment if I test positive? And how do we get it through our system, whether that's Kaiser or UCSF or our own health network? How would that happen? And the health systems are all working on removing barriers within their own structures to be able to do that. And then continue to stay informed. This is one avenue, this discussion we're having, but again, sfgovs/COVID will contain all the information that we want the public to know. Next slide. And then specifically, how can you all as leaders keep your congregations and the people you are serving in the public as safe as possible? Congregations should continue to gather. We are not recommending that people stop gathering. We know how critical it is for social health, mental health, spiritual well-being. And again, at this time, we know how important it is with all the events in the world, and community is so important to many faith traditions. It cannot be done in isolation. So I'm very supportive of that. We are also in a different stage now than we were earlier in the pandemic. And I think you've been hearing me speak to that a little bit about how we manage COVID. We are going to have to live with this virus, and we need to adjust a little bit as we see swells and we see ebbs, but this is part of our daily lives now. We do know how to keep each other safe. We have the tools that we just talked about to do that. We have masks, we have tests. We most importantly have vaccines, including boosters, and we have treatment as well. So all of those are available to us to try and protect ourselves and protect our communities. It's important for congregations to keep in mind the demographics of their houses of worship, of their communities, and it may take extra precautions or adjustment for elderly or high-risk individuals. So general tools to support the congregation should be what you all have done so amazingly, messaging around vaccines and boosters, continuing to wear and encourage masks when indoors, even though it is not a mandate at this point, it's still a strong recommendation, and we would advise it. If it's possible to provide masks, including surgical masks even, that would be a really great thing to do. Reinforcing this message that people should stay home if they're sick or symptomatic, whether that's children coming into children's ministries and children's programs, or staff, clergy, congregants. People should not be coming into congregate settings or to houses of worship if they're not feeling well. And then providing testing resources, telling people where they can get a test through the city, and potentially even keeping a supply of rapid test kits as well. And again, our focus is on equity, and we know that you all are such important partners in that. And another key thing is sharing the messaging on being COVID ready. And it's so wonderful to see at the beginning of these forums how that is part of the general introductory messaging. That's wonderful. Next slide, please. So we know there's lots of emerging topics, and I'm hoping we can get to some of these in the questions, but I wanted to just briefly start by saying we get a lot of questions about long COVID. So long COVID is, after the initial symptoms have resolved, some lingering symptoms that people can describe going on for weeks or months after their initial infection. And the most common of these are fatigue, but there's a whole range of things that people can experience. This is a very active area of scientific research. In fact, we gathered sort of the experts in our Department of Public Health and our expert colleagues at UCSF yesterday to really try and sift through and give us a sense of where this was. And what came out very clearly is there's a lot that needs to still happen, including studies that are being undertaken and planned and will be going underway with UCSF. And we will be doing this in partnership with them, as will the County of San Mateo, to try and talk to people and understand the extent of long COVID in San Francisco. So we will have more understanding to share with you at a future date as that study goes underway. It's very challenging to measure long COVID. There are many different definitions, and it could be, what are you feeling at 2 months after your diagnosis all the way to, 6 months up to a year. The definitions can vary. There's not a standard, and it makes it very, very challenging. It also is a clinical diagnosis. Some people may not have the words to express or may not know that this is what they're experiencing, but they do have symptoms. And so measurement becomes really important. The vaccines do reduce the risk of long COVID. It may not reduce it to zero, but it does reduce the risk. It's possible that getting treatment quickly may also help, but there's, again, studies underway to help determine that. Another area unrelated to COVID, but which I know that people may also have been hearing about in the news, and so I wanted to address because we are actively monitoring this as a health department, is monkeypox. So this is entirely separate from COVID. It is another virus, but it is a very different family and genus of viruses, and it behaves very differently. It has usually been associated with travel to West or Central Africa. There have been small outbreaks in the past in the US. It causes rash, very distinctive rash, and often fever. There have been clusters of cases. That's been very unusual because they've been in people that have not traveled to Africa. And this has happened in 16 countries. And then I learned yesterday that there's a potential case which is being investigated in Sacramento this week. And I think that it may have been confirmed as a case, but I am not 100% certain of that. The virus that causes the disease spreads through prolonged close contact. It causes a very distinctive rash that causes sort of vesicles that then turn into ulcers. And it spreads through prolonged close contact to those lesions or to respiratory secretions, but it doesn't pass through the air as readily as the newer variants of COVID. So it's not as likely to cause widespread disease in the populations. It behaves very differently than COVID-19. We are monitoring the situation. We are getting updates from our state health department partners. And we have systems in place to address this locally, including doing case investigation, contact tracing as well. So our advice to the community is if people are developing a new or unusual rash and or a fever, to go see a doctor immediately if symptomatic, or if they have a known exposure, if someone has said that they were diagnosed with monkeypox or that they have traveled to another country that has had cases of monkeypox and they develop symptoms, we want to know about it, but it should be directed towards your health provider, who should do an evaluation, and then we will work with those providers to do any follow-up testing and advice that's needed. This does not often tend to cause a very severe disease, but again, we want to keep an eye on it. We want to limit spread, and we want to make sure that people have the most information possible that they can as well. Some of the initial cases, but not all, were identified in gay or bisexual men or other men who have sex with men. But again, sexual orientation, gender identity are not a risk factor. We're very cautious. We don't want to perpetrate a stigma against any groups, but what we do want to do is make sure people understand that that we're watching for this, and if they develop new unusual rash, then it's a good idea to seek medical attention and be evaluated. Okay, that is, I think, all I have. Next slide. I just want to thank you all so much, and I'm very happy to talk through any questions.
Dr. Phillip, thank you for this very, very comprehensive and informative presentation. As you know, we've invited faith leaders from throughout the city, a diverse population geographically and from faith traditions, to submit questions in advance. And we received a number of them. And so I'd like to get to them right away. And, I learned in seminary that repetition is a good thing because people pick up on different nuances. And so we will pose these questions now in alphabetical order. Reverend Father Mesrop Ash, the parish priest at St. John the Armenian Orthodox Church and a member of the San Francisco Interfaith Council Board, states and asks, Dr. Phillip, the recent rise in cases has been apparent in our congregation across generational groups and regardless of vaccine status. The vast majority of our congregants report being vaccinated. Thankfully, we haven't witnessed any recent hospitalizations directly due to COVID-19. It has been our impression that gatherings related to our church activities, indoor worship, Sunday school, social gatherings, primarily outdoors, home and hospital visitations, and others have not played a noticeable role in contributing toward the infection rate in our community. Nevertheless, there is an increasing sense that we are approaching an infection point that will require a response that goes beyond recommended mask wearing. In the absence of the return to the prescribed pandemic controls of before, what can spiritual institutions do to help keep their congregations safe, healthy, and especially when it seems that our congregation centers are not the nexus of infections?
Thank you. And I always think that this group poses such important questions. What you are seeing is a reflection of the case rates going up throughout the community. So as you said, it is not a reflection of transmission necessarily happening within houses of worship. Having said that, really encouraging and supporting mask use is really critically important. And then thinking about ways when there is a surge to potentially modify the ways in which people gather. So one practical thing is that I know in some faith traditions, some houses of worship, there is a social time perhaps after a formal service. And if there are food or coffee that are being consumed or other beverages, to see if that can be done outdoors. So while we're having swells, adapting a little bit, using all the information that I know that this group knows so well, to use methods that can decrease transmission. But it's really the things that I spoke about, is making sure the community is informed that cases are going up, and then adjusting and using the tools and the knowledge that you all have and have demonstrated so well to make adjustments.
Thank you. Lydia Branston, the executive director of the Gubbio Project, which hosts what they call Sacred Sleep at St. John the Evangelist Church for homeless folk during the day, states the following: we have a monthly vaccine clinic for our guests, and we test folks who are showing signs of illness. But with the new variants, are the current vaccines still effective, and are there new vaccines that will be recommended?
Thank you. What a great question. Yes, the current vaccines remain effective against preventing severe illness and death. So they are our best tool against severe disease and illness in our communities. So it's still very important to do that. As with many vaccines, effectiveness kind of wanes over time. And so that's why this idea for boosters, and when people are recommended to get a booster, we encourage them to do that. There may be newer vaccines coming into the future. We'll have to see. They may be more variant or subvariant specific. The challenge is that the virus continues to evolve, and we're always playing catch up a little bit. But there is hope that there might be broader, more neutralizing antibodies that will remain effective over time. So we have the tools that we have now, they are effective, and there may be additional tools that we hear of in the future, but that's a wonderful question. Thank you.
We are very blessed to have as a member of our board, Reverend Dr. Jonathan Butler, who is the executive director of the San Francisco African American Faith-Based Coalition. He's also assistant professional researcher for UCSF Department of Family and Community Medicine, and associate pastor and education minister at Third Baptist Church. He asks 3 questions, and I'm going to put all 3 to you, okay? The first is, what is Paxlovid? Who qualifies for it? When should they take it? What are its impacts on long COVID? And can you explain what rebound is and how it may impact the community? And finally, given the upcoming holiday weekend and the increase in COVID cases, what are ways to stay safe and still enjoy time with family? So we've got Paxlovid, rebound, and Memorial Day.
All right, wonderful. And thank you so much, Dr. Butler, for all your work on vaccine equity in San Francisco. We know you've been an important partner, a hugely important partner. Well, Paxlovid is an antiviral medication. It's comprised of two different antiviral medications in one pill. And it really, again, has been shown to reduce the rate of hospitalization, the risk of hospitalization by 90% when taken within 5 days. So the people who are recommended to take Paxlovid are people who are older, who are 60 or 65 and older, and people who are younger than that who may have underlying health conditions. And the underlying conditions are fairly broad. I mean, it could be asthma, it could be chronic, other chronic conditions, blood hypertension, diabetes. So speaking with your doctor if you're under care for any of those conditions is really important, and making a plan ahead of time for getting Paxlovid if you do test positive. This idea of rebound is one of taking Paxlovid. It is a 5-day course of medication, and a small percentage of people a few days after that, 2 to 7 days after that, may actually have a resumption of their symptoms that initially went away with the Paxlovid. This is not thought by all the experts to mean that the virus is becoming resistant to Paxlovid. It may be something about the duration, that we need to take it longer, or people's own, immune systems. People may be able to, again, transmit when they become symptomatic again. So if you do develop symptoms as a rebound, isolate again and then test. And when that test is negative, then okay to sort of resume activities. The good news is that people don't get very sick with rebound. It doesn't put people in the hospital. It does tend to be more mild. So it's something to be aware of, but it should not preclude or prevent anyone from taking this medication. It is strongly recommend that if you're eligible for it, you seek it out and take Paxlovid when offered to you. The last question about, how do we gather? I think, again, we want people to take into mind their own health status and that of people they live with, their own need for connection. We know it's so important. But if they're going to be in larger gatherings, it's always preferable to be outdoors or indoors, making sure doors and windows are open, ventilation is good. We know that people, even with vaccine, can test positive, and that people can reduce the risk of long COVID with vaccination, but maybe not to zero. So it really depends on people's own level of concern for getting infected at all and for long COVID. Masks, again, are protective. Testing prior to gathering is also an effective thing to do. Being outdoors. There are many ways in which people can mitigate the risk by layering on these levels of protection before they come together.
The Most Reverend Salvatore Cordileone, Archbishop of the Archdiocese of San Francisco, asks, is there any sense at this point as to the long-term behavior of the virus? Is it foreseen that at some point hospitalizations and infection rates along with early treatment will be such that the spread of the virus will be manageable? Or is it foreseen that we will need to be taking mitigation precautions for the indefinite future?
This is such a wonderful question. And this is really what, as public health, we're trying to evaluate and looking to our federal partners and state partners and research colleagues to really help us understand this. I do think that we will be living with this virus for some time, and the level of mitigation, the level of information that people need and the precautions they may want to take may vary, and this will sort of ebb and flow. But right now, we don't have a clear trajectory to say, oh, it's going to continue to dwindle down and it won't recur, or that, is it possible that something new will arise in the future that requires us to revisit some of the stronger measures that we had in place. This virus has been very wily, and everyone who said they know exactly the way things are going to go has been wrong. So I will not dare to do this. We know that it's very challenging to predict. It hasn't been possible to date, but we do know that adding in all the tools that we have, all the understanding that we have about how to keep people as safe as possible, allows people to make some of those decisions for themselves and to share information with their congregations and with others as well.
Maha El-Ganaidi, the founder and innovation director of the Islamic Network Groups, asks, doesn't summer and hot weather slow down the virus?
There was a lot of thought about this, that the more humid weather would cause the virus particles to drop out of the air. There's also the fact that, in the summer, we tend to be more outside overall in the US and the Northern Hemisphere, but it didn't work exactly that way when we were looking at the Southern Hemisphere. When it was winter here, at some points, there were still surges during summer in Australia and New Zealand. There were still cases. So it's not 100% correct. But again, we're going to hope and see that since we are having a little swell, we're hoping that the immunity that we have from both vaccine and natural infection will help us kind of stem any further swells this summer. But again, the virus changing a little bit could change that. But the most important thing to us is that we are preventing severe illness and disease with the high level of vaccination that we have in San Francisco.
Reverend Norman Fong, the Parish Associate for Presbyterian Church of Chinatown and San Francisco Interfaith Council board member, asks, since half of Chinatown residents live in SROs, single room occupancies, and it's so difficult to shelter in place since kitchens and bathrooms are shared, what is the Department of Public Health's policy in regards to serving SRO residents who test positive for COVID? What if there's an outbreak in an SRO hotel anywhere, for instance, the Mission, Tenderloin, Soma, or Chinatown?
Thank you. Yes, and partnering with SRO residents and with advocacy organizations that work with residents and with SRO organizations, it's been really important throughout the pandemic. And so, as a city, we continue to maintain our COVID resource center. And again, we shared the number in the slides. I'm happy to send that out again to really make sure that people know that they can call if they need assistance with those things, with isolating, et cetera, to be able to do that. And we were able to very successfully prevent very severe infections and illness and death among SRO residents, along with other congregant settings where people are sharing space, like in long-term care facilities and in skilled nursing facilities. So it remains an important area, and we continue to have partnerships. It's not just DPH, there are other city departments as well that are involved in providing services to CBOs, and there are a lot of community organizations that serve CBOs as well. So again, we're working with those organizations to provide them with the same types of information that we're giving you, and maintaining our resource center so that we can assist if there are individual questions or individual cases of need where we can help.
Thank you. Iftikhar Hai, president of United Muslims of America Interfaith Alliance, asks, how do I convince my neighbor who retired as a nurse respiratory therapist and refuses to take an anti-COVID vaccination? So far, she has not taken a single COVID shot when the COVID started, and she thinks it's not necessary.
This is such a difficult question. I thank you so much for asking it. And I think, as all things, we meet people where they are, and we gently give them correct information if there's misinformation that they may have, but ultimately it's each individual person's choice. And we've been so grateful for all the help in getting correct information out to communities, to having there be trusted messengers from communities that have also helped carry this message, including, so importantly, faith leaders in doing this messaging. I would say that if that person has a provider, a care provider, or someone that they trust and have a relationship with, then encouraging a discussion with that person as a learned person that understands the science and also knows that person, because these discussions, I mean, you all can tell me more than I can tell you, have to happen in relationship, and that's the advice that I would give. But it's a very difficult situation, I know.
An effective response. Reverend Maggie Henderson, pastor of Old First Presbyterian Church and past chair of our council, asks, we know some people who are getting the second booster. How important is it for people to get it, and why? We hear that the new variant is very contagious. Is this true? What do you think about wearing masks in closed spaces with some ventilation?
Yes, thank you. The new variants, the subvariants, are quite contagious, and they spread quite readily. They are no more likely to cause people to have very severe disease or death if people have been vaccinated. So vaccination remains the key. And at this point, given the swells that we're seeing, there's a national recommendation for people over 50 to go ahead and get their second booster, depending on the length of time it's been since their last one. So we want to make sure that people are thinking about that, or talking with their own providers, or considering getting that. We do think it's important because immunity can wane over time. And what do we think about masking and ventilation? I think it's really important, and as houses of worship have done, to maximize their ventilation, and when there are swells and upticks as there are now, to continue to strongly recommend and encourage masking. People are sometimes asking, well, why don't we come back and mandate masks and just tell people that they have to wear them? One of the principles of public health ethics is always trying to do the least restrictive measure that is necessary to save life, preserve life, because we want to allow people as much autonomy as possible. In medical care and public health, that's always the case. We want to give people information and make sure that they have what they need. Because we have all of these tools now, we don't have the same risk of widespread severe illness, widespread death in San Francisco. We do want to make sure that people have the access that they need to these tools, and that's why equity continues to be our focus. But at this point, given where we are with the severity of disease that's caused by COVID, we're much more relying on people's very good understanding at this point of the risk tolerance that they have for themselves and the prevention measures that are available to them.
San Francisco Human Rights Commissioner and Interfaith Council board member Hala Hijazi asks, in support of the White House Test to Treat initiative, what is the city and county of San Francisco's efforts to educate the public, including underserved and vulnerable communities, about 24/7 telehealth services and treatment, including Paxlovid? How accessible is treatment, and is it free?
Thank you. Yes, it's very important. Treatment is free. This is such a very good point. Thank you so much for raising it. Treatment is free. Vaccinations continue to be free, no cost to people. And there are multiple ways to get tests for free as well. This issue of making sure that people are aware of Paxlovid, we have been doing concerted efforts to increase communications to the public around this. We're working also directly with our health systems and doing work internally within our own health system at the DPH, the San Francisco Health Network, to remove barriers. One of the challenges, as I mentioned earlier, is that we were able to, with federal funding, do sort of very innovative new programs and partnerships very early on in the pandemic. We are now having to rely more on our core health infrastructure and public health infrastructure to do things. So that's where we're really putting most of our efforts. It is very important for people to get access to Paxlovid within 5 days of testing positive. That's where it's been shown to be most effective at preventing severe disease. So it is important for people to do that as soon as possible. And some health systems may have 24/7 access, but again, we're trying to leverage the state-of-the-art health systems and hospitals and clinics that we have in San Francisco, and they've all been very committed to doing their part to increase access.
Heather Lee, the program manager for San Francisco Community Agencies Responding to Disasters, says, for myself, the most difficult part of Together Apart and Zoom Church was the loss of communal singing. And when I hear that the case counts are rising and that new variants are taking hold, it is the loss of this communal singing that was only recently restored to us that hurts the most. I'm wondering if rapid testing before services would be considered sufficient to balance the risks and to allow us to continue to gather and to continue singing. And if so, since it can be a considerable expense, does the health department know of more cost-effective ways that our churches and other communal singing groups could cost-effectively acquire the test for a time such as this?
Thank you for that question. Yes, we are not at this time telling houses of worship or other groups that they should not sing. So I think it is okay to sing. Ideally, it would be singing with masks on, and I know that is not what we would all want to have happen either, but that might be an adjustment during this swell to take, and to really require or ask as a congregation that people use well-fitted masks. Also, cloth masks are not very effective against these newer subvariants, cloth masks alone. So if you're using cloth, you should have a surgical mask under it. And in terms of testing, I mean, that is the possibility. It is a bit onerous to have to try to do that for an entire congregation every time that you are gathering. And in terms of testing resources, again, what we are trying to do is really think about an equity approach, and the resources that we do have, which are decreasing as the federal allocations decrease or have not been continuing, is really to focus that within communities and within neighborhoods that have been most impacted. So I think that the easy access to testing is a bit of a challenge, but there can be home tests that can be obtained through the federal government. That's one way of considering that as well. But I think that that's an important topic and important consideration. We're certainly not recommending that you must do testing every time you come together if there's singing. I would say that the masks would be a great idea at a minimum.
I'm in this unenviable position where we've come to the hour. There are a number of other great questions here, but I want to be respectful of your time as well, Dr. Phillip, and say thank you to you for your incredible presentation and response to these questions. I will be sending the questions to you, and if we could get response perhaps from your staff, that would be great, so we could send them to those who posed them. But thank you so very much. And we want to thank Reverend Bowman and Nancy Nielsen as well. We continue to offer our prayers for our health officer and all of those who are working so hard to protect us. And we continue to be good partners with you all. Thank you, Dr. Phillip.
Thank you so much, and thank you all for your time, and most importantly for your continued partnership and advocacy, and thank you for your prayers as well.
As we're saying thank you, I also want to say a special thanks to Cynthia Zambucas and Trey Russell Allen for their contributions to the success of these programs in this series, and invite you all to join us next Thursday, June 2nd, when we will welcome founder and co-executive director of the Community Living Campaign, Marie Jobling, who will teach us about the critical services that CLC is offering with respect to aging adults and people with disabilities. This concludes our program for the day. We thank you for being with us. God bless you and God keep you.